Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, the Big Weck. Joining us on the Big Weck's Buffalo on the Rise today is Dr. Mo from Chiro First Wellness Center. Doctor?
How are you?
Nice to see you today.
Same here.
You know, let's talk a little bit about what's different about your center. I mean, I know we've probably all experienced things with the chiropractors before, and they, you know, I know they used to refer to, you know, going in and getting adjusted and popped and cracked and all this kind of jazz. It's come a long way from things like that, right?
There's a lot of different technology out there. We're proud to say that we boast that we have one of the best technologies out there, ProAdjuster technology. It's a adjusting tool that we can help patients without any twisting, turning, cracking, or popping. We have all kinds of patients coming in, people that have had surgeries that, you know, maybe told that they were never, they couldn't get adjusted again. Now they're coming in our office and we're helping them and alleviating some of their pain and symptoms.
You know, it's funny because some people are adverse to doctor. If I have to go see a doctor, they get kind of nervous. So I wouldn't think that going to a chiropractor would cause any sort of fear in individuals, but there are some people that just, you know, have a little bit of a fear of that too, right?
Some people are afraid of being manipulated. They're afraid of being cracked, right? So the tools that we have in our office, like the ProAdjuster, like our spinal decompression, can help alleviate a lot of those symptoms and a lot of that pain. Without that, you know, manipulation or twisting, turning, cracking, or popping, and it's very effective. And we've had a lot of patients over the years that come back and refer their friends and family because of that.
Is it something, do they have to lay down on something? Do they have to have, you know, different leads put on them? I mean, how does something like this work with the ProAdjuster?
It's a instrument-assisted tool, and the person is in either a comfortable seated position if they can't lay down, or we can lay them down if need be. So what it does is it delivers a gentle percussive force into the spine or into other joints and into the muscles to help restore range of motion and alignment.
Wow. So it's kind of like hands off.
Pretty much, yeah.
Really? Tell us about some of the other things. Now, spinal decompression, I guess buzzword now, shockwave therapy. Tell us about these things, what they do.
So the spinal decompression is great for a herniated, bulging disc, for even degenerated disc syndrome, and people having radiating symptoms going down into their legs or down into their arms. What it does is it gently just tractions or stretches out the spine, and it kind of pumps the disc to take that pressure off those nerves, alleviating the pain. And the shockwave therapy is different as well, because what that does is it sends like a percussive sound wave into a joint or into a muscle to break up scar tissue, help increase range of motion, and reduce pain. It's very, very effective. We've seen a lot of benefits with that, bringing it to the office.
Didn't they do something similar to that with kidney stones?
Yes. So it's the same technology that they would use with lithotripsy. So they've just modified it where now you can use it for musculoskeletal conditions.
And what about the laser? You talked a little bit about the MLS laser. What does this do?
So it's a class 4 laser, but it's different. It's a multi-locked system, so it fires 2 different wavelengths of energy at the same time to help reduce pain, to help increase range of motion, and to help speed up recovery. So we have a lot of patients that may come in post-surgical for like a knee issue, or they may have like what we call a hot disc where their body's really inflamed, and you can use that to help alleviate the pain without even physically touching that area.
All right, now the minute that I say laser, somebody's going to say, oh, I'm going to get burned. It's going to hurt. You know, tell us about that.
They won't get burnt. It is made to use for on musculoskeletal conditions, and the MLS laser specifically that we have is you can also use that on joint replacements, which is the only class 4 laser that you can actually use on joint replacements.
If someone was to come in for something like that, maybe it's a muscular thing or something of this nature, how many times, how many visits do they have to come in for? Is it an extended period of time?
It's different for everybody, and it depends on what we need to use. So for instance, we've had patients come in for frozen shoulder. You know, they've done all kinds of therapies and treatments, PT, chiro, injections. We've had patients come in for 8 visits with the shockwave therapy, full range of motion, all the pain is gone, and they feel great.
What about neuropathy? We hear a lot of people talking about this now, and maybe it's related to type 2 diabetes or whatever, people have tingling in their feet, in their legs. Can any of these things that you talk about help that?
Yeah, so we use a combination of the laser therapy along with the shock wave, as well as something else that we have in our office called Rebuilder to help with neuropathy symptoms. And kind of marrying those three different technologies together has been very effective for our neuropathy patients.
So it's not something where it sounds like the days of you're just getting older, you're going to have to live with it. It sounds like those days may be gone. You may be able to modify these things even if you're an older patient.
Exactly. So, these technologies are out there. They're helping patients with their symptoms without the use of any drugs or surgery, and they're enhancing their lives.
What about massage therapy? Do you do that as well?
We have a great massage therapist in our office, and she's constantly busy and does really, really good in combination with the chiropractic and the massage and all the other things that we have together. When you combine all that, people leave feeling great.
What do you think is the most common ailment that people come to you for?
Number one thing that people come in for is low back issues and hip issues. Those are number 1 and 2, and then also neck would be, on the top of the list as well.
Yeah, I think with people looking down at their cell phones like this all the time,
Yep.
and then your neck is going to bother you, or the computer, right? That's another thing that people do. All right, in the event that people want to come and see you, they can come and see you for an evaluation, and you'll kind of figure out what they may need, right?
Exactly. Come in, initial consult, eval, and then we'll go from there.
All right, thank you very much, Dr. Moe. We appreciate it. For more information and answers to your questions, contact Chiro First Wellness Center by calling 716-675-2225 or go to ChiroFirstWellnessCenter.com. Sponsorship and promotional consideration for the preceding segment was provided by Chiro First Wellness Center. And make sure you join me morning 7 to 9 a.m. on Buffalo's oldie station, The Big Wack.